can get started on time so we can get out on time. I'm Phyllis Adams, and I'm not Linda Ginter, who was supposed to be here right now to welcome, but she's ill this afternoon, and I want to thank everybody for coming. This is a great event, and we are very appreciative of Kentucky Youth Advocates and all the work that they do for the state. And now to come here, this is the third community conversation program that has been set up. First Jefferson County, Carter County, and now Madison County, that invites the large number of folks in like we are doing this afternoon. I'm going to go ahead and get started and invite you all to give a round of applause to Amy Swan from Kentucky Youth Advocates.
Good afternoon. Thank you so much for inviting me. We have a great turnout. It's very exciting to see so many people passionate about advocating for the kids in their community. Like Phil said, my name is Amy Swan. I'm the Kids Count Coordinator at Kentucky Youth Advocates. And for those who aren't familiar with Kentucky Youth Advocates, we are a nonpartisan, nonprofit children's advocacy organization. We're the only one of our kind in Kentucky that deals with such a wide range of children's issues. There's a lot of child advocacy groups that focus on health or K-12 education, for example. We try to tackle the whole gamut of stuff. So health and education are what we're going to primarily focus on today, but we also work on juvenile justice issues, child welfare, tax and budget issues for families, economic well-being, all kinds of stuff. We use strategies ranging from lobbying and administrative negotiations to coalition building and public education, all in order to obviously bring about changes needed to improve the well-being of Kentucky's children. And probably the best known public education effort that we do is the Kids Count book. That's something that hopefully everybody picked up at the registration table when they came in. We should have plenty, and in fact, if you'd like to take another one, if we have extras back to a colleague, I'd be more than happy to not have to lug them back to Jefferson County, so please do that. Like Phyllis said, the 2011 Kentucky Kids Count book, you'll notice if you flip through it, that it really focuses on various child health issues. We're going to talk about a lot of those points today. The 2012 Kids Count book, which we are in the process of trying to get off to the printer, is going to focus on children's education issues. And like Phyllis said, we're going to be emailing all of you that are here today to notify you when that has been officially released to the public, and so that you can order as many free copies of that book as you want. Okay, so I've mentioned this Kids Count project. What is Kids Count? It's a project that was started by the Annie E. Casey Foundation. They're a national philanthropic organization, and for those who don't know, and I wouldn't expect you to, the Annie E. Casey Foundation was started by the Casey family that founded UPS. So it's no surprise when you think about the family that founded UPS that they are all about data, because they are almost obsessed with measuring metrics within their business. They want to know exactly how long it takes for a package to get off the back of the delivery truck and to the front door, and find out, are there any things that we can do to really increase the efficiency of our efforts. They're very passionate about the well-being of America's children, and so they started this Kids Count project, which is really gathering as many indicators across the states and for the nation as a whole about child well-being and putting it out there, because it's really kind of founded on this maxim that what gets measured gets changed, okay? It's also founded on a core principle that's one of Kentucky Youth Advocates' core principles, that we need to be engaging in data-driven advocacy in order to promote data-based decision-making when it comes to policies and practices being crafted on behalf of our kids. I should say that while the Casey Foundation started the Kids Count project, they quickly realized that they should have somebody in every state in the nation be doing a Kids Count project within their state. where they're not just looking at data for their state, but for their counties and school districts as well. So Kentucky Youth Advocates is that grantee. We've been doing it for a little over 20 years now and are very proud of that effort. I always want to start off a presentation about the data for the children in a particular community, discussing child poverty. Growing up in poverty is one of the greatest threats to healthy development. Poverty and financial stress can actually impede children's cognitive development and their ability to learn. It can contribute to behavioral, social, emotional problems, and also poor health. So definitely a contributing factor to some of the specific metrics that we're going to look at today. Now, a decade ago, more than 1 in every 5 Kentucky children lived in poverty. Now, it's actually more than 1 in every 4. It's going to be difficult to see the number because of the color used on the slide, but the percentage that we have there for Kentucky is 26.3% of all children living in poverty. So more than 1 in every 4. Just a really startling statistic that, you know, makes me shiver every time I hear it. Now, when you broaden that struggling population to not just those kids who are technically living in poverty, you know, 100% below the federal poverty level, but to expand that to those who are not below poverty but are still really struggling, which we call low income. When you look at that, which is 200% of the federal poverty level, then you've got 49% of all Kentucky children being in a low income or poverty situation. So almost 1 in every 2 children in this state. Just kind of takes my breath away. There are approximately 17,800 children in Madison County. That's based on the latest census data that we have. So what this means, the good news for Madison County, is that that population size is large enough that there are single-year child poverty data available on an annual basis that are fairly strong and reliable. So 2010 is the latest year of data that's available for Madison County, and it had a child poverty rate of 28%. So that's higher than the rate for the state as a whole. Definitely something disconcerting. I also looked at the median household income for this county. The median household income for families with children is $55,000. So what that's really getting at is that half of all people in the county are above that mark, half of all folks are below, and actually not all people, like I said, families with children specifically. The risk posed by economic hardship are greatest among young children who experience poverty, like I said, when they're young. So I kind of broke out what the poverty data say for Kentucky by age groups, and so you can see that in Kentucky, this specific stuff is not available at the county level. So this is Kentucky data, and you can see that 1 in 3 children under the age of 5 are living in poverty. Then when we look at all the kids 5 and up, 5 through 17, 1 in 4 again. Oh, actually, I'm glad I looked at my notes. I do have the Madison County data available. Let's see, it says Madison County, the percentages are 30% and 26% respectively. Okay, so a lot of questions that we need to be talking about as communities about what are specific interventions that we need to be doing to target families with young children, since that's where the greater proportion of our child poverty is residing. Okay, we're going to jump in. We're going to talk about some health indicators. And the first one is smoking during pregnancy. Kentucky remains in the very unenviable position of having the highest rate in the nation of mothers smoking at some point during their pregnancy at 24%. This statistic 21% is for Madison County, so you have a little more than 1 in every 5 mothers giving birth having smoked at some point during the pregnancy. Lower than the state rate, but obviously still far too high given the really dire consequences the research shows when it comes to smoking during pregnancy. I saw that a smoke-free ordinance went into effect in this county in June of 2007. It looks like it was implemented, making workplaces and all the enclosed public places 100% smoke-free. Preliminary data show that Madison County's smoking during pregnancy rate has decreased by 2 percentage points since the ordinance took effect, but that's a very short time frame that I was able to look at because our state vital statistics office is so behind on finalizing and getting out newer vital stats. So something to definitely monitor as newer data becomes available to see if that's a trend that's really going to continue. Kentucky Youth Advocates is actually advocating with a variety of partners for a statewide smoke-free law so that all employees in Kentucky are free from secondhand smoke regardless of the zip code that they live and work in. The U.S. Surgeon General has actually found a causal relationship between cigarette smoke and all of those negative effects that you see on the slide. So not just the correlation, but a direct cause. Cigarette smoking by a mother during pregnancy is actually the single most important known cause of low birth weight for babies. The good news is that if a woman stops smoking at any time in her pregnancy, even during the 3rd trimester, the baby's health can improve. So it's really important, that we be providing, educating, making aware, advertising, and utilizing tobacco cessation programs, not just for the pregnant women in the community, but really for all women of childbearing age. Because what we know is that a lot of women don't realize they're pregnant until they're at some point into their 1st trimester. So if we want to do true prevention, we've got to hit women of childbearing age. A little bit of data about low birth weight. Kentucky's rates of low weight births have remained persistently high, higher than the nation, and unfortunately have been gradually increasing over the years, to the point where now almost 1 in every 10 babies born in Kentucky is born at a low weight birth. And if you're wondering what I mean by low birth weight, the metric is less than 5.5 pounds, I believe. Madison County's rate has also been slowly creeping up in recent years, according to that latest vital statistics information that's available to the public. In that case, a full 10% of babies born in 2009 were born at a low birth weight. Prenatal care. So obviously, an important connection here with what we were just talking about. Prenatal care is vital not only for checking on the health of the mother and the baby throughout the pregnancy, but also for having that opportunity to engage in the patient education and counseling. And we would say that talking about smoking cessation with pregnant women who haven't quit yet should be right up there in those visits of topics that are covered. And unfortunately, the percent of pregnant women receiving adequate prenatal care has been declining, as you can see on the graph, both for Kentucky and Madison County. Now, what I mean when I say that we're measuring adequate prenatal care is that we're defining that as starting the prenatal care within the first 13 weeks of pregnancy and receiving at least 10 prenatal visits throughout the course of the pregnancy. Okay, so it's going to be hard for you to see on there, especially with the tiny little numbers on my graph, but Madison County's rate in 2009 was 58%, lower than the statewide rate of 64%. So a lot of work to do there. It's very concerning that these numbers have been going down instead of up. And you really can't help but wonder, would Madison County's rates on smoking during pregnancy, low birth weight, preterm births, would all that look very different if more than just 58% of pregnant women were receiving adequate prenatal care? Obviously, there's lots of issues about, you know, knowledge about the importance of prenatal care, but there's also issues of access to prenatal care. There's issues of quality prenatal care, etc. I mentioned preterm births. I just want to quickly say, I'm not going to throw out the data on it, but I always want to notify audiences that KET did a wonderful documentary called Born Too Soon. And it talks about not just preterm births, but also low-weight births, smoking during pregnancy, all these things that we've just been covering. Really excellent. It's available on their website to watch for free. So I would really encourage those who work with women in the community of childbearing age, specifically those working with pregnant women, to check out that documentary called Born Too Soon. It shows how some communities, actually I think a community in eastern Kentucky is highlighted. It's been so long since I've watched it, I can't remember. But how hospitals are educating not only their doctors, but also their patients in tandem about the importance of really working with patients to carry those pregnancies to as close to full term as possible and let nature take its course, because unfortunately there's been this really disturbing trend in medicine across the nation of folks scheduling their deliveries. Okay, breastfeeding, and then we're gonna, I promise, move on from the babies into the older kids. Breastfeeding, you know, research shows offers both moms and infants better health outcomes. Research demonstrates that babies actually have better protection against sudden infant death syndrome, asthma, diabetes, ear infections, allergies, even obesity later in life, and the list kind of goes on and on. For mom, there's actually decreased risk for breast cancer, ovarian cancer, heart disease, and postpartum depression. So it's kind of a win-win situation. Breastfeeding rates for Kentucky have been among the very lowest in the nation, but that is starting to slowly change. Kentucky's making great strides in the percent of babies that are breastfed at least once before discharge from the hospital. It's actually increased from, in Kentucky, 48% in 2004 to 56% in 2009. So we still have a long way to go to get to that 100%, but we're moving in the right direction at least. Madison County, the rates have also been increasing over the past few years, from 55% in 2004 to 62% in 2009. And I'm expecting, obviously I'll monitor this to see if this comes true, but I'm really expecting that we're going to continue to see progress on this metric for not just Madison County, but for counties throughout the state because of a new program that has recently been implemented across the state. For those who aren't familiar, Kangaroo Care is the name of the program. It was created by the WIC program, Women, Infants, and Children's program, that does special nutrition assistance and whatnot with families with very, very young infants, and also the U of L Hospital Center for Women and Infants. They have spread this program that promotes skin-to-skin contact with mother and baby in the very first hours after birth and throughout the hospital stay. To not, they started a pilot project, I should say, at this U of L Hospital Center for Women and Infants. It had such immediate results in a dramatic increase in their breastfeeding rates that they realized, okay, there's really something to this program. So they created a toolkit, and they have now trained all of the birthing hospitals throughout Kentucky. So I expect that because they had such success at that one hospital, because it's now spread, we're going to continue to see Kentucky's breastfeeding rates go up. Teen births, communities, rightly so, tend to be very interested in knowing how things are looking on this front. For many decades, the nation and the states were experiencing a fairly steady downward trend when it comes to teen birth rates. Then there was kind of a blip on the radar a couple years ago, and you can see that towards the far right, where it jumped up a little unexpectedly there. The good news, is that the preliminary data for 2009, which is the very last data point on the graph, shows that the rate is moving downward again. Again, unfortunately, this 2009 data is the latest that we have from the Vital Statistics Office. But since you're not going to be able to tell from the tiny numbers, what that statistic is for Madison County in 2009 is 32 births per 1,000 females ages 15 to 19. And it's lower than the state's rate. But there's a more interesting statistic for me, and that is the percent of teen births that occurred that year to young mothers, to young women who were already mothers, who already had children. So in Madison County, 18% of teen births in 2009 were to teenage females who already had at least one child. So that really shows me that there's a lot of room for prevention work with young females that, we may have thought, oh, they're out of our reach. Well, it's never too late to try and prevent those subsequent births if they're not in a position to really take care of those children. A couple of statistics for the state as a whole, because it's not available at the county level. There's a youth risk behavior survey that's done among Kentucky high school students. It showed that in 2011, 52% of Kentucky high school students had sexual intercourse. Okay, so that's more than half. So we're fooling ourselves if we say, oh, it's not happening. We don't have to worry about that. 49% did not use a condom. 74% did not use birth control, pills, rings, implants, etc. So a very real issue that needs continued attention and diligent efforts for, even though that trend, like I said, has historically been moving in the right direction. Health coverage. We all know that having access to health care is critical for prevention and early diagnosis of health problems, and that a primary care provider, or what's deemed a medical home, is really the ideal avenue for receiving care, not the emergency room, which is unfortunately where many uninsured folks have to go for their care. According to brand new data just released on the 12th of this month by the Census Bureau, 5.8% of children in Kentucky had no health coverage in the 2010-2011 time frame. That's down from 8.7% in the 2000 to 2001 time frame. So we've made a lot of strides in making sure that the children in this state do have some form of health coverage. And one thing that we've done a great job of is making sure that those who are income eligible for Medicaid or KCHIP are actually signed up and using it. And that's what this data is referencing. There are a couple things that the state did to move in that right direction. They removed the mandatory face-to-face interview for families. So instead of having to find a way to have transportation and lug all the kiddos down to the local DCPS office, they were able to take care of a bunch of that stuff by mail and by phone. Also got rid of the premiums that parents had to pay unless they were in really abject poverty. And making that a priority in the state budget is what was able to make that happen. So that really improved retention rates right there. From 2000 to 2010, so in the past decade, Madison County's Medicaid enrollment of children grew by 72% and KCHIP by 75%. That growth outpaces that of the state as a whole, although there was significant growth there as well. So in Kentucky, it was 52% growth and 45%. Here we have 72% and 75%. We know that some of these increases are due to the push over the past 3 years from the governor's office, making that a priority to enroll all eligible children. However, we also know that there are likely more eligible children now than a decade ago because of the lingering effects of the recent recession. Oral health, another very big issue that Kentucky still has a lot of progress to make on. This data is specific to Madison County, showing that when you're just looking at the population of kids who are receiving Medicaid or KCHIP, that 61% of that population actually utilized dental services in 2010. That means that there's still 39% of children on Medicaid or KCHIP that didn't receive any dental services. And we're not even talking about an annual cleaning here. So a lot of work to still do, moving in the right direction though, because it was 44% in 2001. An estimated 1 of every 3 children in Kentucky suffers from problems like cavities, bleeding gums. The Pew Center recently did a report that that statistic comes from. We know that a kid in pain is not able to concentrate in school. So this is one example where, you know, a child's health really does have a direct impact on their educational achievement. In response to these issues, a lot of communities in Kentucky have gotten creative, and they've formed collaborations between schools and schools of dentistry, health department offices, to provide on-site dental services to students at their schools. More and more use of mobile dental clinic vans coming directly to the school, because hey, okay, this is where the kids are. We know where to catch them. So let's go ahead and provide those services to them as soon as school lets out. We know that one of the big issues in Kentucky is a real lack of licensed dentists throughout the state. And then on top of that is a further lack of pediatric dentists who specialize in treating children's oral health issues. Madison County, we did an essay on all of this oral health stuff and this data that I'm getting ready to share. It's in the Kids Count book that you all have if you want some more information. But Madison County has 31 licensed dentists, but at least 40 providers build Medicaid and KCHIP for providing dental services to children. So what that means is that Madison County, and this is something I would applaud the county for doing, has said, okay, we only have so many licensed dentists to go around, for the entire population. So, are there other types of providers that can at least be doing the cleanings, that can at least be helping with fluoridation stuff? So that's why that 40 number is higher than your 31 licensed dentists, is because they're obviously using non-dentists to try to further meet that community oral health need. Early childhood obesity. Child obesity is a really hot topic right now. It seems like you're kind of always hearing a newspaper story, a news report, a radio story, something about it. It's because we're starting to do a better job of actually capturing it, but we have a long way to go. Kentucky is actually experiencing a childhood obesity epidemic, and I say that because in Kentucky, we have the 3rd highest rate in the nation of overweight and obese children. 37% of our children ages 10 to 17 are overweight or obese. And there's actually new data from that Youth Risk Behavior Survey 2011 data that says 16% of high school students in Kentucky are obese. So we've got some data for ages 10 to 17, we've got some data specific to high schoolers. What we don't have, especially at the county level, is data for children of all ages who are experiencing obesity. The only data that we have for every single county in Kentucky that is consistent, that can truly be compared county to county, is data on early childhood obesity, which is what is mapped here. That's from that Women, Infants, and Children's program. Now, the thing we have to keep in mind is that that's a very, very specific population, because women, infants, and children, so first of all, that's just one program. It's one program. It's a program that you have to be low income to participate. It's a program that only serves very, very young children. So the children in this data are between the ages of 2 and 4. Okay, so very tiny population. Sometimes I hate to even show it to people because it's just, it's so not strong. But for those who can't read these tiny little numbers, Madison County, within that very specific population, had 16% of those children, ages 2 to 4, participating in WIC, already obese at that young age. Okay. I'm trying to hurry up so I can get to the juicy education data. So I'll just say that Kentucky Youth Advocates is working on that issue, the fact that we don't have any really great quality, consistent county-level child obesity. There's some legislation that we've been advocating for, and we can certainly speak more with anyone who's interested afterwards about what we're trying to do there to get the quality data. Physical activity is also obviously one way to reduce childhood obesity. That Youth Risk Behavior Survey showed that for Kentucky, among high school students, 21% are not getting even an hour of physical activity on any given day. 65% are not attending a PE class on any given week. 32% are watching 3 or 4 hours of TV per school day. Okay, so lots of behaviors that we need to be changing in order to increase the physical activity among our young people. And there's some legislation that can, that's a big part of what we do, is legislation on behalf of kids and lobby in order to get that passed. And so there's some legislation specific to that again, I'd be happy to talk to anybody about afterwards. But right now we're going to jump over into some education metrics. So obviously, I want you all to kind of have the demographic context for the data that I'm going to be sharing with you. So this is the latest available data on the school district enrollment for both the Madison County School District and the Berea Independent. So while Berea Independent's enrollment size is 1/10 of the county school districts, you see that the racial makeup of those two different student bodies is very similar. Both have white students comprising more than 87% of the student body and between 4 to 5% African American students, with really the only significant, and it's not really that statistically significant, of a difference being that they kind of flip-flop in terms of the percentages for Hispanic and children of all other races outside of both Black and Hispanic. Free and reduced price meal eligibility. This is commonly an indicator that's kind of used as a proxy for student poverty within school-aged children. You'll see that, unsurprisingly, there was a lot of increased growth in student eligibility because of the recent recession. Although it's really interesting that while Kentucky continues, that Kentucky's the red line, while they continue to see upward movement within this most recent year, Madison County moved down a little bit. Now I need to point out that on this graph, in order for you to see two distinct lines, our access is going from 35% to 65%. Okay, so if this was from 0 to 100, it'd be very hard to discern the differences between Kentucky and Madison. Because we're working on that 2012 Kids Count data book that focuses on education, I have some new data that we haven't even had a chance to put up on our data center yet. So we just got data for fiscal year 2012 on this. And what we see is that in Kentucky, 56% of all public school students are eligible for free or reduced price meals. In Berea Independent, it's 59% of all students, and in Madison County School District, it's 54%. So still very high proportions of children that obviously come from families who are struggling to make ends meet. Proficiency. What is portrayed here are the No Child Left Behind proficiency scores. I call it subject proficiency because the specific data that's portrayed is children meeting proficiency or above, okay? So technically it's not proficiency, it's proficiency and those above scores. And what you see is that there's some really apparent disparities within our student populations. The blue bars are all students. All students tested because there are specific grades that are tested. The red bars are students who have low income specifically. The green bars are students who specifically have documented disabilities. So you can see that there's some very obvious and persistent and repeated disparities, both at the state and the school district level, and for both reading and math. And then I just want to point out again, because it's kind of hard to read these tiny little numbers, that in this instance, in order to kind of fit it on my slide, we're only going up to 80%, okay? So while you see some of these blue bars getting near the top there, that's not near 100%. Those blue bars still have a long way to go, okay? So really just, really kind of shocking that we have so many students that aren't even at grade level in such fundamentals as reading. And I just want to quickly say that for those who are interested in this, in learning more, I'm happy to talk. The ATOD Foundation that does the National Kids Count Project put out a report recently called Learning to Read, Reading to Learn. Basically, it's documenting that what we've learned is that it's so vital, I mean literally vital, to future educational success for students to be truly proficient in reading no later than the end of 3rd grade. Because what they found is, up to that point, kids are learning how to read. But after that point, they have to know how to read in order to learn all of these other subjects. So we have data specific to that 3rd grade reading proficiency for Kentucky, and again, I can talk to you afterwards. High school graduation rates, obviously very, very important given what we know about our changing economy. You know, this is no longer the era where you can have an easy time getting a really family-sustaining job with a high school degree alone, and good luck, you know, getting a family-sustaining job without a high school graduate degree. So what this is portraying is a new metric that the state is using for graduation called Average Freshman Graduation Rate, AFGR. Basically, it's something that all states are doing, and there's actually going to be a whole other, even stronger metric that states adopt in the very near future. It's an attempt to better capture students graduating on time, okay? Kentucky is the blue line, where you can see there's just kind of been some very, very gradual growth. Berea Independent is the red line. I know that these jumps look really severe, but you know, keep in mind what our access is, which is from 60% to 100%. And Madison County is the green there. So you can see that the latest data we have available, school year 2010-2011, you've got Berea Independent doing just a little bit better than Madison County, both of them doing just a little bit better than the state as a whole when it comes to graduating students on time. College success. So like I said, you know, in our changing economy, it's very important that not only are we getting kids through high school, but that we are also making sure that they're either getting some sort of associate's or bachelor's degree, or at least, you know, getting into the workforce in a successful way. We've got data about the college readiness. So for fall of 2010, we were looking at the percent of students who are entering college with academic needs, meaning they're really going to need some remedial help. So Kentucky, 50%. 50% of kids getting into college need some sort of remedial help. Madison County, a little bit under that at 44%. We also look at the 6-year college graduation rate, you know, because you would hope that with the right services, tutoring, et cetera, that most students would be able to get that bachelor's degree within 6 years at the most. For Kentucky, 48.7%, Madison County 49.7%. So we might be, doing good on getting kids through high school. We might be doing good on making sure they're actually ready to take that next step to enter college. Or are they getting through college? And what we find is that too many kids are dropping out. Okay, so I am just going to say for these next slides kind of what you can find in your handout. Everybody should have a packet of stuff within this little blue brochure on top of their yellow bags. I'm not going to spend any time talking about this because it's also listed in Ruth's handout, which is this Kids Count Data Center. It's the online clearinghouse for all of the 100 plus indicators of child well-being that Kentucky Youth Advocates collects and monitors, as well as all the data that the other states in the country do for their states, counties, and school districts, as well as all of the data that the Annie Casey Foundation does for the states and the nation as a whole. So you don't need to memorize that web link that takes you directly to our stuff because it's on a sticker on the back of your blue pamphlet. Next, I'm just going to say that another handout you have in your stack of stuff is a front and back. It's got a variety of ways that if you're interested in becoming more active on any of these issues or any of the many other issues that Kentucky Youth Advocates works on, there are a lot of ways to get in touch with us, to partner with us. Again, we encourage all child advocates to be looking at that data for their county's children, to be calling or talking to their legislators about children's issues, showing them it is a priority, to be, further educating their peers by writing a letter to the editor or op-ed in their newspaper. While we have Facebook, Twitter, blog, all of that, the easiest way is just to go to our website, kyouth.org, sign up for our listserv. That way you don't have to worry about missing anything, and we're not the kind of folks that send out emails all the time. You might get 1, 2 a week tops. On the back of the handout, you're going to see that there are some very specific ways that you could get more formally involved with KYA and our partners. We lead a very large 70-plus strong coalition of child advocates across the state called the Blueprint for Kentucky's Children that lobbies on a agreed upon common agenda on behalf of children. So there's that opportunity, and that website's listed. One thing I wanted to spend just a minute to make sure everyone in this community is aware of, because it's happening in one of your neighboring counties, is a nonpartisan rally in Danville on October 10th. That's the day before the vice presidential debate is happening there at Center College. We've been working with community partners there to set up this rally. Basically, we wanted Kentucky citizens to have an opportunity to show the candidates that Kentuckians want children to be a priority, not only in their campaigns during the campaign season, but more importantly, in whatever work it is that they're promising to do, making sure that gets delivered if they're elected. Again, it's nonpartisan rally on behalf of children's issues. That's going to be on the courthouse lawn in Danville. It's at the corner of Main and 4th Street. It starts at 1 o'clock, but if you want to get there early, registration starts at 11:30. I've heard there's going to be free t-shirts. Other thing, our biggest advocacy event that we do for going on 9 years now is called Children's Advocacy Day at the Capitol in Frankfurt. Last year we had just a banner turnout with over 1,300 people from all across the state descending on the Capitol Rotunda. So it was just amazing. Again, it's the same concept, it's showing our elected leaders that, we mean business when we say children are our future, and we need to be treating them as such and planning accordingly. Basically, we ask folks after the rally ends in the morning to have set up meetings with their elected officials and to sit down and talk to them. We provide lots of educational materials that people can use if they want in those meetings. We really encourage people from across the state to come We don't want it to just be a Frankfurt residents event. You know, we want this to be a statewide event, and we really want children and youth there. Now, it makes sense when you think about it. So we ask folks to bring a group of students. We have folks that bring, debate clubs, cheerleading squads, you name it. So that's wonderful. And then the last handout in the packet of stuff is talking about our most upcoming event on October 8th. It's the Step Up for Kids event. It's going to be in Louisville. This one does cost money. Everything else I've talked about is completely free. This one does have a price tag attached because there are going to be meals, and there's lots of folks that we're having to fly in from national organizations. But it's got all the information there, including where you go to register if you're interested in that. Okay, thank you. Next, Ruth Hopkins with the local health department is going to come and talk some more.
I promise to try not to bore you to death with statistics, but one of the things when we talked about the planning for this meeting was to share with the community a variety of resources that might be used if you're seeking grant funding related to families and children. And so I'm going to be using some county and state as well as national statistical sources so that you can kind of look at what's available and how you might be able to use those for any grant applications you might be seeking in the future. You do have at your seat a handout of reliable sources for data information, and Amy referenced that for the kids count, but there's quite a variety of sources that we have used and other agencies have used to really seek funding or attempt to seek funding for various programs that we hope will help improve the health and security of our families and children for Madison County. A couple of things I want to do today is just talk about some critical issues that we see are facing children and families here locally. Amy's already talked about a good bit of this, and you're going to see some duplication between what I've prepared and what Amy's prepared because we did these presentations separately. So you'll see a little overlap, but you'll see some differences as well. And then the second objective is to disseminate information on reliable sources, which I've already talked about. A few years ago, we started the health department to really pull together a comprehensive community health assessment. We used a nationally recognized format for that. It's called the MAP process. And several people in this room was engaged in the early stages of using MAP and also helping to develop a community health improvement plan. And we've used this data, we've updated data over time. Our first assessment was done in 2007, and then last year we updated it with new information that came out. Go ahead. And then, as I said, we have formed what is called a community health, comprehensive community health improvement plan. And this came together by several folks present here today, being a part of it, providing information in its development, and actually looking and implementing programs that's aimed to address the key components of the improvement plan. The first priority that was chosen by the group was physical health, focusing on overweight, obesity, and lack of physical activity. And as Amy said, this is one that gets lots of attention today. And we've really worked at trying to make great strides locally in how these are addressed. This particular slide shows how we have prepped up with obesity. I just used one area with that being high school students, but as you can see, Kentucky is estimated that 15% of high school students in 2003 were considered obese, and by 2011 it had crept up to 17%. Different statistics will show different amounts of increase in that number. but this is looking at one source from the CDC. Fiscal inactivity. I think Amy referenced some of these statistics when she talked about fiscal inactivity and obesity. But as you can see here again from CDC, and this is 2011 Kentucky Youth Risk Behavioral Survey, we had 21% of students did not participate in at least 60 minutes of physical activity on any day. The physical education, we only, 65% did not participate or attend physical education classes in an average a week, and so on. And I'm not going to go on to this because Amy's pretty much talked about it. We are seeing in some of the studies more focus on the percentages of time that students or young people sit in front of the computer or gaming sources. In some, I think this will be an interesting statistic to look at over time, is how much our youth are staying stationary in front of a computer versus being active. Of course, there are some games that are, you know, like the Wii and some of those that have tried to get students or young people more actively involved, but it remains to be seen how that changes. Nutrition, again, I just pulled one area. Again, this is from the State Youth Risk Behavioral Survey for 2011, and it focuses on an area of nutrition. When we're looking at obesity and nutrition, we're looking at a variety of sources of where students or young people do not get adequate nutrition, and combining that with the lack of physical inactivity, which is certainly leading to the obesity or the overweight problem. But this is showing across the United States for 2011 the areas around the United States where students did not eat vegetables. And we know throughout information from school systems and other sources, daycare centers, etc., that many of our young people are not introduced to much variety of vegetables in their home. And they also are resistant to trying new things that they might encounter in the school cafeteria or other sources. Sometimes the student their only vegetable that they know about is French fries. It's really discouraging sometimes when we see the variety of programs that are offered to our young people that they do not attempt to try new and different kinds of fruits or vegetables, but stick with the traditional ones. I will have to say that the school systems here in Madison County are working very diligently to making some changes in the school lunch programs. There's more involvement in the county on trying to introduce farm-to-school programs and looking at a variety of sources where children, particularly like even in daycare centers, have more variety of fruits and vegetables to help them in their nutritional intake. A second area that we looked at in the Community Health Improvement Plan focused on reducing the health and financial impact of alcohol, tobacco, and other drugs in Madison County. And I'm probably going to spend a little bit more time in this area because this is a very disturbing and growing area of what we're facing in the county. This one brochure picture here is a copy of a brochure that we, the health department, developed a year or so ago to really start trying to focus a lot of attention in the county on what is the problem with prescription drugs and how so many adults and young people are now involved with the illegal use of prescription drugs. Before I get into that a little bit, I'm going to just focus a couple of slides, one on binge drinking. This is information that has come from the KCHIP survey. We have encouraged and worked advocately for the school systems to be involved in participating in the KCHIP survey because it does give us very good data about youth across the state, but also youth behavior across the state in a variety of areas, but also the data comes back to the school system in terms of helping the schools individually know what their population is engaged in from a behavioral perspective. I chose grade 10 to look at in the year of 2010 on binge drinking. The KIP survey surveys every other year, and they survey at the 6th, 8th, 10th, and 12th grade levels. So what we have by using the KIP survey is giving some good trending over time in a variety of areas. One area that will be looked at in this year's survey, as I understand it, are some questions around prescription drug use. But as you can see with the binge drinking area, this is grouped by the area development district levels. But for 16-year-olds, binge drinking, 5 or more drinks in a row in the past 2 weeks, and the bluegrass area, I think, is like at 15%. So, you know, when you think about the 15% or so youth that you encounter, either in the school system or in your church youth group, that's a significant number who are engaging in very risky behaviors at a very early age. The next slide focuses on cigarette use of youth, 30-day use. Again, this is a KIP survey, and as Amy talked about, and as we all know, we are a high smoking state, and unfortunately, many of our youth begin very early in their years with tobacco use. You know, we've had anecdotal notes from adults who participate in our cessation program, but also from staff who work with kids in the schools, that sometimes youth and adults start as early as 3rd grade smoking. And to me, that's very alarming when I hear that kind of information. Cigarettes often are used as rewards for good grades. Sometimes they're used as a way in which to help normalize youth into the family setting. They're also used, cigarettes are used to help people just feel part of their social group. With the prescription drug use, we had a survey done back in the spring, and we asked people, what do you think are the most risky behaviors in Madison County? Prescription drug abuse was #1. This was a survey that was done with teen or youth in the county in 2011, and it asked where youth use prescription drugs. And as you can see, the areas that they're most focused on in terms of their use was in school or work, and in the area of home. Controlled substance prescriptions. This is something that is really being focused a lot on at the state level, at the county level, and I'm sure Chief Brock is probably going to touch on this a little bit in terms of what they encounter from law enforcement. But as you can see, we're having, these are the 4 most prescribed controlled substances for the 404 zip code. This includes all of Madison County, a little bit of Estill, Jackson, Rockcastle, Gary, Lincoln, and Wall counties. But hydrocodone is one of the most prominent prescribed drugs, and it is also one of the most abused drugs. We hear a lot of attention, or we hear a lot of information about oxycodone, and it's a little bit lower. It has peaked higher in the past, but we now think that so much attention has been focused on the oxycodone that a lot of physicians are stepping down the drug that they prescribe in their potency and going to the hydrocodone. This just shows prescription usage in Madison County per 1,000 people, and this is just for first quarters of the years from 2009 to the first quarter of this year. And as you will see, hydrocodone has really jumped up in the amount of prescription usage for Madison County. There's a survey that just came out, it's just published this year, this August. This is a national survey done by Columbia University program on addiction and looks at substance abuse among teens. And you can see over a variety of time where the prescription drug as well as other substances has ranked in terms of the use. I wanted to show this particularly because, and I highlighted the middle school. We often think that more drug use is focused, or attention is focused at the high school level, but now we're seeing the usage creeping down into the middle school level, which is again very disturbing. Where students use substances, tobacco, alcohol, marijuana, when you see the impact of children being home alone, this certainly makes a very clear picture as to how young people are engaging in the uses of a variety of substances. Some mental health issues, and I'm going to run through these pretty quickly, but I wanted to, even though we didn't talk about it in the CHIP program, a lot of attention about unintentional injury or intentional injury. I think these statistics are significant enough for us to look at them. But this came from the CDC, it's called Youth Online High School Youth Behavioral Risk Survey. And it focuses on attempted suicide one or more times by young people. And I think that it's really this is among 9th graders. This to me is very alarming because when we think about the number of kids who actually do attempt suicide, you know, we're seeing this, even though there's no significance in changes between the years, it's still a high percentage of children who consider that the only option they have out to cope with their problems is suicide. Ever physically forced to have sexual intercourse. This is another significant, I think, statistic to look at in terms of what we generally think is a female issue, but this actually looks at males in the number that are included in that. Hit, slapped, physically hurt on purpose by a boyfriend or girlfriend. Again, we tend to think this is a female-related issue, but as you can see here, the statistics are very similar between male and female. Ever been electronically bullied? This is a new area that's being looked at in terms of the statistics, so we only have 2011. But again, a very high percentage, particularly of females, and I think anyone who's here from the school system can identify with maybe some young folks where this is occurring. Phyllis is giving me the sign to shut up, but I have just a couple more that I'm going to run through pretty quickly. This I'm not going to talk about in any kind of depth, but Amy mentioned this in terms of sexual activity, teen pregnancy prevention. One of the things that I think is significant here is the amount of youth who engage in very risky sexual behavior without protection. And that's protection against pregnancy, but also protection against sexually transmitted diseases. Priority 3 in the Community Health Improvement Plan lumped a lot of areas together. Healthcare disparities, women at risk for preterm deliveries or low birth weight infants, uninsured, underinsured, Spanish-speaking individuals, and the health illiterate. This just talks a little bit about health illiteracy. One of the things that research is showing is that many Americans are becoming more illiterate over time. And when we think about the impact that that has on how individuals comprehend or can read health information, it greatly impacts their overall health, not only for themselves, but also for their family. So when we think about how we make interventions, whether that's in the school level, school areas, or in healthcare settings, illiteracy is a major problem that we have to deal with. Amy talked about preventing really a healthy start in the premature rate, birth rate. Kentucky, unfortunately, by march of dimes, obtained a D for the status of dealing with premature births in Kentucky. This is something that's just been published, and this deals with youth, deals with babies, but it also deals tied to prescription drugs. And this was a statement that was made by Van Ingram, who's with the Kentucky Office of Drug Control Policy. Hospitalization for addicted newborns soared from 29 in the year 2000 to 730 in the 2011, which translates to 2,400% increase. This is very, very alarming to me. He also says, by continuing to warn students across Kentucky about the dangers of prescription drug abuse, I'm confident that we can stop this epidemic and protect the next generation of Kentuckians. I just want to end with this to say that, you know, through community improvement for families and children, we have many assets, and you can see those. We also have many challenges, more than's up here, but we certainly have many challenges in which to address the various issues that will help to improve the health and welfare of our children and families. The next person that's going to talk is Teresa Stewart, and she's the Richmond Supervisor for Community-Based Services.
How are y'all doing? I know I'm not going to give many statistics, okay? Everybody knows the statistics that are going on. But I want to talk about child protective issues in Madison County. You know, Madison County is a large county. We've been classified as an urban county versus rural, so we lost a lot of services. So when we lost services, our caseloads increased. School systems generally is our largest reporting of abuse and neglect. They see kids more than anybody else. So first and foremost, we've had so many staff changes that there's a packet of information so you all can keep this handy so you all know all the workers coming in and out of the schools, businesses, who you can provide information to, where you can reach them, what office. There's going to be, we used to have 20 workers, but because our caseloads have increased, we're going up to 22 workers. And our last two will actually be on and employed October 1st, which are on the list here. We want you to be able to reach us because, you know, we're here to protect families. That's what you're here to do. And to learn about what this community needs. I did provide data on what the statistics are for not only Southern Bluegrass. Madison County is a part of the Southern Bluegrass, which is 10 counties. You know, it's surrounded by, you know, Clark, Jessamine, Gary, Lincoln, Boyle, Fayette. You know, there's 10 counties total that comprise the Southern Bluegrass region. Well, Madison County is very different than, we've got a big city. We call Madison County the little big city because we are classified as a big city and urban, but we have small town problems too. And we get everything from the drug issues to domestic violence to everything going on with the substance abuse. Substance abuse is one of the biggest features that we deal with on a day-to-day basis because it affects every aspect of a child's life. You know, kids generally, we're not dealing with the children as much doing the drugs until they're juveniles. We're dealing with the parents dealing with it, and the kids having the fallout from drug-addicted babies to all the way to kids can't get to school on time or even come to school, or they're too tired to even learn because their parents have been up doing drugs all night long. So drugs have a huge impact on the community. And we're working to try and find solutions within our community to address these issues. That's hard because, you know, people, until they're ready to treat their drug problem, you can't get them the help. We're seeing a huge rise in the number of kids in being taken out of the home. And I'm not just talking kids in foster care. I'm talking about when we've had to find kids' family members to raise them. You know, because they can't remember, the risk issues are too high to stay in their own home. We don't have treatment facilities. We don't have testing facilities. Not to meet the needs of everybody that has a drug problem. And even if we did have a facility that could meet everybody's needs, we'd have to have that individual be ready to take treatment. So that is a huge, you know, barrier. You know, and one of the aspects on that is that we now have, just in Madison County, just this week, I pulled the data from a week ago, we have 162 active investigations with 8 workers and investigators. That's a lot of cases. And then kids that are either placed with a relative or are staying in the home with their parents, there's 173 of those cases. Kids that are placed in our homes, we have 87 families that have kids in foster care in this area. But we have 176 kids. That means we've got a lot of big sibling groups. One of the barriers and one of the things that people don't understand, the worst thing for a kid to happen is to be placed in foster care. It is devastating. It can ruin their life. And everybody's like, put it in foster care. It'll fix it. No, it makes it worse for the kid. Sometimes we don't have an option. We can't find an option. What's even worse is if we take them out of their home and we can't even put them in their own community. Problem is, we've got so many kids in foster care, we don't have enough homes. I'm now placing kids in Eastern Kentucky or Western Kentucky. There's not anything in the middle of the state. That's one thing that, you know, everybody asks, what can we do as a community? And they don't think about that. You know, what can we do at the ground level? There are so many kids out there that need mentors. There are so many people out there that, you know, I'm lucky I've got good kids. Most people are lucky to have good kids. It's not the kid's problem that gets them taken out of the home generally. It's the parents' problem, parents' issue that puts the kids at risk. We need foster homes. We need parents who are going to, you know, parents that are parenting their children that are willing to mentor and work with other kids in the community. You know, it's unfair that, you know, as a teacher or as a counselor or a principal or someone in the church, that you have fought hard to work with this kid to help them out in every aspect, and no matter what you did, things didn't work. And then they have to be taken and put, you know, 3 hours away. That's a short-term solution to where we can start working with these families. And I mean, kids are our future. And if we destroy them, then there's no way to rebuild it. Intergenerational abuse is something that occurs and is getting worse and worse. You know, if you have 60 cases of kids, of families, and then 10 years down the road, 80% of them go on because that's all they knew was that abuse, and they carry it on to their kids. We've got to stop that cycle. And most people don't realize how big that cycle is. You know, because it doesn't affect them, or you don't see it. And that's what the average American is that if they don't see it. Or, you know, they see things that go on, but they're like, how do we deal with that? You know, right now we're fighting, you know, a lot of slum wars. I mean, for lack of better terms, These housings are substandard. Nobody should be living in them, in my opinion. And then we're fighting bed bugs because these people are so poor they can't throw out their stuff. Where are they going to get it replaced? And then, if you have bed bugs, you've got to not only replace everything, but you got to take everything you own to the laundromat. They can't afford to go to the laundromat. They can't afford a gallon of milk sometimes. So, I mean, people need to be aware and understand what our community is about. Everybody's invested in this community in their own little aspect. And the one thing about that coming together is a huge issue is, all of us working together. If we can all bring one little piece to the table and help a family, it's a good thing. I did include, like I said, I did include some things. We are above the statewide average in our region. Now, I could not pull our county data, but for our region, which is the Southern Bluegrass, income issues, we have a higher percentage. Domestic violence, 5% higher. Then substance abuse, we're 4% higher. Mental health issues, we're right on target. Same with the statewide. Families that have more than 2 issues, we're 2% higher. That's a lot going on in the families in that, in this region. The community partners are doing a good job of pulling together, and we're trying to be there to meet the needs of these families. What I want and what I would love to see is more preventative measures. Social service is not preventative. We're there after the fact. We're there to address the issue once it occurs and there's been an incident. We wish we didn't have a job. We're probably the only ones out there that wish we didn't have a job. If we didn't have a job, kids would be safe. But we're here to do what we can. So if my workers or other workers, if you need them, if they need you, work together. Anything we could do to improve the lives of kids in this county, it would be a good thing. Thank you. And I'm going to introduce Chief Larry Brock.
Good afternoon, everyone. First thing I talked to a couple of people coming in, and I kind of feel like, I'm preaching to the choir to some extent because most of the people in here are within the system or know what a lot of the problems are, and really the people we need here are probably the people in the community that don't deal with these issues every day that we're talking about here. Unfortunately, I guess that's just what we have to deal with. But Pastor Bly, I know how you feel now. I feel like I'm preaching to the choir, maybe like you do a lot on Sunday, like people need to reach right in there. But I'll do the best I can here with to try to convey some information to you, and it's not going to be a lot of statistics and things like that. I want to tell you some real stories that I've experienced and kind of hits on some of the things Ruth and Teresa talked about. First question I want to ask everybody, and CW, you can't answer this because you know the answer, but and if you're in the court system, you know the answer. But I wonder what people think in here. You see the news, you read the newspaper. What do you think is the most common charges filed against juveniles in Madison County? One person said truancy. Anybody else? Any ideas? Theft, robbery, drugs. Talk about drugs a lot. What problem that is?
I don't know if the drugs term is, so I've heard people say Alice from
Okay, I'm gonna come back to those. Just remember, some of you have heard this, you know it, CWs know it, but, and you've heard truancy and out of control from this side. I know that since I'm from the law enforcement perspective, a lot of people probably think that I've talked a lot about the drug problem, and rightfully so. The drugs are a significant problem in the community. You've heard Ruth talk about that. Drug use and abuse is connected to so many other crimes we deal with: burglaries, thefts, robberies, all those things. A lot of that is connected to drug use for one reason or another. And these are crimes being committed by adults, and a lot of these adults are parents. As a matter of fact, I think I talked about this in a previous forum. A national survey on drug use found that Kentucky was in the top 10 in several categories for persons aged 12 and older, those being the non-medical use of pain relievers, the use of illicit drugs other than marijuana, and illicit drug dependence. Kentucky loses over 1,000 people a year to deaths from prescription drug use, more than an auto accident. So drugs are a problem. And there was a community report in 2011, and a question put to a group of young people, I think it was 103 students. What makes young people want to try prescription drugs, and what is appealing about them? There were several responses. There was one response that every single kid said was a reason for kids wanting to use drugs. Number one, every kid said it. 103 out of 103, peer pressure. And what are we doing to address peer pressure? How are we teaching the kids how to deal with that? How do you deal with peer pressure? Because that's the number one. Every one of the kids said that is the main factor. And so, if we don't listen to that, we're missing the boat. Where the kids, this is another one to the kids, where they get their facts on about prescription drugs. Where do you get your facts about prescription drugs? As you might imagine, almost 24% get their information on prescription drugs from TV and the media. 12% get their information from the internet. That's no surprise, really, is it? I mean, we all know kids texting the internet, social networking. 18%, now that's 30, 35, 36% from media and internet sources. 18% said they get their information, their facts in school. Now it doesn't specify whether that's good information from educators or that's bad information from other kids in the school. So we don't know the answer to that. 12% get their information from their families. A little more than 1 in 10 are learning about prescription drugs or the dangers from their families. Which is part of the problem I want to talk about. We assume that drugs and violence are the main issues involving our young people, and those do exist. It's kind of funny for me to say. They're not the most common things we see, especially, after we just had a case where we arrested a 17-year-old for killing his grandmother 4 years ago. But those are the rare cases, very unique. Most of the cases aren't that serious. But what I want to touch on and get to is, from what I see, the underlying factor for most issues faced by teenagers and our young folks is a lack of parental involvement and or positive reinforcement or role modeling from adults in their life. No doubt, a great deal of this is due to substance abuse by the adults, as we've talked about. We can never escape the drug component as it stands right now. That's just a fact of life. You've all heard that before. I'm not telling you anything you don't know. But now, having heard that, I'm going to go back to what's the most common charges filed. The folks on this side of the room are right. Number one, and CWs tell you, these are the ladies that take these complaints. Number one, in the county, number one charge filed against juveniles in the county, beyond reasonable control. Right, ladies? What is beyond reasonable control? Well, it's a status offense, first of all, meaning, it's only charged against a child, not charged against an adult. You have to be under 18 to receive such a charge. And it can only be filed by a parent, legal guardian, or the school. Usually it's if the juvenile has a repetitive history of activities such as staying out all night, being combative, argumentative with the parent, drug use, or and is a safety risk to him or herself or to others. parent, legal guardian, school, and file that complaint. Number 2, habitual truancy. Habitual truancy can only be filed by the school, 6 or more unexcused absences, kick that in. You got, if I say something wrong, correct me, okay? Now, what's that go back to? And you've heard some of the kids have to get their own selves up. Kids have to, get themselves ready to go to school. They don't have breakfast because the parents, like Teresa says, we have a lot of interactions with Teresa's folks. The parents are drug abusers, substance abusers. They're sleeping in. Kids are getting themselves up. Maybe they're getting their younger siblings up, trying to get them to school. And sometimes it just doesn't work. I mean, when I was in high school, I didn't want to go to school either. I didn't want to get up at 7 in the morning. I hated it, but I'm still that way. I'm a night person. When I have to be at work every morning, I get up at 6 or 6:30. It's killing me. But my grandmother was chirping in my ear. My grandparents raised me. She was chirping in my ear every 2 minutes. Get up, you got to go to school. Get up, you got to go to school. I got up just to get away from her. And it's a fact. Not because I wanted to go to school, but this is what does not happen with these kids. There's nobody there pushing them. And I'll tell you another little story here in a minute about that. I feel like the kids want rules. And I can say that we have a summer camp for kids, and I'm not saying this to toot our horn. We have a summer camp for kids, and I started it for a reason other than imposing rules. But we have pretty strict rules in the summer camp because we have a lot of kids in there that don't have any rules anywhere else. They don't have any family rules. They don't have any rules. In school they have some rules. But I was pretty strict. And we try to teach them things like, don't put your hands on other people. You ever try to tell a whole 50, 11, 14-year-olds, don't put your hands on other kids? It's pretty challenging. But, they learn some things as we go along. And they also learn, and we all know that consequences part of your brain doesn't develop until later, so they don't always understand consequences. But we're trying to impose something. If you do this, this is what's going to happen. And then we do that. And, pretty soon the group sees what happens to one student that does that. We don't run them off. We don't kick them out. They have to do something really bad, but maybe you don't get to participate in the next activity. Or maybe you don't get to make a field trip that we're taking that you really like to. Pretty soon, guess what? They're following rules. But they don't have that at home. Kids are always, they're going to make bad decisions. Heck, I make bad decisions. I'll tell you about some of those too. But, they kind of, and we all know this, kids, as they're growing up, they start repeating behaviors they observe. What's normal for them. Like, for example, we arrest parents periodically, and parents have their kids with them shoplifting. Now, I'm not talking about a 2-year-old who doesn't know what's going on. I'm talking about the parents hiding over in the clothing section, telling the kid to go over in the CD section and bring you the CD. And the kid's old enough to go pick out the CD, they won't take it to them. They hide it in the purse, or, the guy hides it in his coat or whatever. And, they're witnessing shoplifting. So what do you think is going to happen? The kid's going to be a shoplifter like when he gets old. There was a program, there was a juvenile drug court program, and the funding for that got cut. And one of the things Teresa talked about was a lack of options, and a number of us that sit on different panels and things, we are familiar with the lack of options. Juvenile drug court was something that got cut, the funding got cut, so locally there was a group that started a juvenile substance abuse program, which kind of replaces the juvenile drug court program, to try to help some of the kids that have drug issues to get through that. And so I want to tell you a couple of stories that kind of come from that, because I'm on that team, and it's kind of an eye-opener for me to hear some of the stories and see how the kids progress once you impose some consequences and rules and things like that, and how they kind of take, a lot of times they'll take off once they can get through some of the problems they have. Let me say this, before I came here today, just to tell you some of the things you see, there was a 22-year-old man in our interview room. One of Teresa's work was there, one of our officers was there. They were interviewing this 22-year-old man for sexual assault on a 10-year-old girl, who he was related to, and I gotta be careful what I say, because it's obviously an ongoing case. But what we learned from that is there's 5 kids in the home. One's 10, one's 7, one's 6. The other 2 are younger than that. Not one of them has spent one day in school prior to this year. The 10-year-old signed up and then didn't go. Now, you know that's a parental problem. But again, to get back to, how's this kid 10 years old and haven't even been in the first grade yet? Much less, I can't have been in nothing. And now is a victim of sexual abuse. Had the 22-year-old's name on her pants, with a heart around. Come on. Where's the parents? Anyway, let me get back to this real quick. We talked about rules. There was a kid, until he was 14, he lived with his dad. His dad had rather strict rules, and the kid apparently, from all indications, did well. For whatever reason, he went to live with his mom for a while. His mom had a drug abuse issue. So he went right downhill, got into trouble, ended up having anger problems, ended up in this substance abuse program I'm talking about. And almost all the kids, the first phase of it, they have a lot of problems. They fail a lot, and they have to suffer consequences for it. Sometimes that means detention for a day or 2. And then they start getting the hang of it. But this kid he's been doing really well in the program, and then his parents have, in my view, failed, and he's had to slip back. But we were talking to him about his life, and he talked about his dad having strict rules, and you would think the kid, we talk about, I think kids want rules. His dad had strict rules, and when he was with his dad, had any problem. And he said, this is from his mouth. My mom wanted to be my friend. She didn't have any rules. I kind of did anything I wanted to. Next thing you know, using drugs. And he says, and that's why he got in trouble, because my mom didn't have any rules and options. Now he is in a placement somewhere because there's no other adult in his family that the judge could send him to. So he's in a placement, not in that detention center, but in another facility where he's going through a program, simply because there's nobody else, no responsible adult to take the kid. Lack of options, and his thing is, I hope I can go back and stay with my dad because he had rules. And we asked him, well, do you think you can live with those rules? Yeah, I do. My life was better when I had those rules. So that was a kid that was in a probably a decent situation and fell into a bad situation. Now the reverse is true as well. There was another kid, I think he'd been with his mother in another state, and he's had some problems, came to live with his dad here. Had a lot of problems early in the program, and his dad was dedicated to making sure that, he did everything he could to get his son on the right path. A real involved parent. And to the point that the dad had some issues himself, trying to deal with his son's problem, and sought some help. And we were able to connect him to a counselor with our friends at CompCare that talked to him and helped him work through his problems. And now this young man has gotten a job. His life is made some money, now his life is really taking off drugs, and, you know, talking about going on, you know, he wanted to quit school at one point, now I'm understanding is he wants to go on with his education, perhaps go to college. From somebody who had some pretty significant issues prior to, you know, getting switched over to the other parent. So, again, rules and staying involved. Y'all probably saw in the newspaper recently, 4 kids playing in the street, 7:30 at night, ages 21 months to 5 years old. 7:30 at night, playing in the street, and in an area full of apartment complexes. And the parents were all passed out in the house under the influence of liquor. Social services come, I think they took all the kids, but, you know, come on. Again, 7:30 at night, 5-year-old, that don't be out playing in the street without supervision? Likely not. But those are the things we see all the time. Here's one for you. Some of you have heard me say this. I was going to work one morning, you know, 7 to 7:30. I heard a radio call dispatch to an officer. Go to a house because the parent cannot get her 6-year-old to go to school. Are you kidding me? 6 years old? You can't get your 6-year-old to go to school? This is what I'm talking about, to me, parental issues. I mean, I don't get it. I call the officer, no, that's not a police officer's job. You go get a 6-year-old out of bed and send them to school. First, we don't have any authority to do that. But it's not law enforcement's job. But a lot of these parental responsibilities are being pushed off onto the police, onto social services, onto the schools. I mean, you all know this. I'm not telling you I don't know. You don't know. 6 years old, come on. You know, if I told my grandfather when I was 6 years old I'm not going to school, I wouldn't be here talking to you right now. This is kind of a communication issue. This is not, and these are not kids that were in our substance abuse program. I was walking out of work one day, a man comes in, catches me in the lobby, probably 6:30, 7 o'clock at night. I need somebody to talk to my daughter. I've had all I can stand. Well, what's the problem? She doesn't appreciate anything I do for her. Try to take her clothes shopping, she don't want any part of it. She's mad at me. So, you know, how old is your daughter? I think she's 13. Where's she at in the car? So I said, all right, I'll go talk to her, you know. So I go out and talk to her. She's sitting in the car. Talked for 10 minutes. She never said one word to me. I talked to her for 10 minutes, just tell me what's going on, just try to figure it out, and, you know, finally come around to basically, you know, lack of communication, parents not talking to the kids, not listening to the kids when they talk back, and I'm not, listening doesn't mean you have to agree, but, you know, it doesn't hurt to listen, you know what the kids are thinking, and, you know, this kid's thinking, Dad's got a new girlfriend, he don't care about me anymore. I'm not important in his life. He waits till the day before school, takes me to get clothes, and buys me one pair of pants. You know, and I'm in middle school. I can't wear the same pair of pants every day. All right, I mean, we can all relate to that. And, you know, of course, his side of the story is he tried to take her before she wouldn't go and all this kind of thing. So we ended, you know, 2 or 3 hours, I'm like a mediator going back and forth, trying to solve something that they should be talking between themselves about. And we finally got it solved and, you know, followed up on it. So I think they worked some of that out, but, you know, again, I mean, not that I don't mind doing that, but really that's parents and kids should be talking. Really, the police don't need to be involved with that. You know, social services really doesn't need to do it. Schools don't need to be involved with that. But that's not what's happening. Sometimes parents' priorities baffle me, and I'll give you a good example. When your teenage daughter or son is sending nude images of themselves to others on their smartphone, we confiscate the phone because that's child pornography, and it's contraband. You know, we had a case where I think there was a teenage girl sent a nude picture of herself to a teenage boy, and he sent it to 20 other boys. So that's what teenage boys are going to do. You know, I mean, we know that. So, you know, there's an uproar, we go over there, the police take everybody's phone, because we got contraband on it. Then when the parents come into the police station, what do you think they're saying? Yeah, the majority aren't saying, they are expressing concern about the 15-year-old girl sending a nude photo of herself, or the 20 boys that have sent it all amongst themselves. No. They're on our case, they're angry because we've got their phone into our smartphone. Are you serious? Really? So, back to the, you know, I mean, this is the message the kids, they're seeing from the parent. Happens in schools, I'm sure, all the time. You know, when you come in, I usually say, well, wait a minute, what about what's going on with your kids? You know, the teachers, educators have to do something with the kids. The parent comes to school. You know, when I was a young kid, you didn't want your parents come to school. And a lot of you know that, too. Now, parents come to school, they jump on the educator in front of the kids. So what message does that send the kid? You don't have to do what anybody tells you. You don't have to do what the police tell you. You don't have to do what the educators tell you, because I'm going to come in and defend you no matter what. Even if you're wrong, it's okay. Those have given me time, so I'll just a couple more points and I'll get out. I think we've as a society, and the police are as guilty of this as anybody else, we've kind of started toward criminalizing conduct of teenagers that teenagers are going to do. I mean, you know, you're going to have fights in school. You're going to have kids every now and then that cuss a teacher or something. You know, the zero tolerance for weapons in the school, we all agree with that. But, you know, sometimes I think it's progressed to every little thing we want to take into the criminal justice system or to social services or to the police. And the police, we do the same thing. And when I was a kid, I got in trouble. Several friends of mine decided we were going to break the windshield out of a tow truck in a parking lot. Not because we were bad kids, because we got with a kid that, you know, was a little bit older than us. He had bad intentions, and we got in trouble. I'm not blaming him. I knew better. But the police didn't come, and they found out who we were real quick. They didn't come and take me to jail and call a CDW, and I had to go in court and get some kind of record. You know what they did? They went and told my grandparents that night. I went home, had to live, you know, was embarrassed, had to, you know, hear that. Next day, they come and got me and my grandmother, and she had to go down and pay my part for that windshield. Never saw a courtroom, never saw a judge. That's how it was handled. That doesn't happen anymore. I'm not saying that it's any better, but it certainly can't be much worse than us putting kids in the system and they can't get the services they need and they get a record. Now, in the military, you think juvenile records are protected? If you get a court record as a juvenile, military has a background check. They make you waive that protection so they can get your juvenile records at the police department. I'll just end with this quote a little bit, or not a quote, but I think if you don't have any rules for your kids when they're like 2 to 12, how do you think you're going to impose rules when they're a teenager? Trying to push the envelope. I did it. I pushed it. You know, and I got slapped down when I should have got slapped down. But, you know, kids resent that. You haven't had any rules for me until I'm 13, now you want to give me rules? They resent that. They'll tell you, I mean, they're angry about it. They're angry about parents not being parents. We hear that all the time. A DJJ worker told us the other day, a juvenile probation officer told us, that some kids want to go to detention because that's detention for us, for juveniles, means in a lockup because they feel safer and they get better treatment there than they get at home. Now that's a sad case. I mean, I want to go be locked up because I get better treatment there. And the officer told, she said, sometimes they tell her that the kids say, the police officer that's driving me to the detention center has listened to me more than my parents listened to me and talked to me. So I'll leave it at that. That's my point, kind of, is, you know, we're always blaming the kids, but, you know, we need to look at the parents and address some of those issues in some fashion. Thank you very much.
This is the interactive part, and it's going to be quick, and we'll get out on time. Chief wouldn't believe this about me, but I've had a few times where I've had to pay for things in my youth. I won't get the details. No, I'm trying to get this thing to come back to do its thing, and it's not going to. But Phyllis asked me to just mention a couple things about the international state communities. Yeah, got it. We are going to be passing out a form that looks like this. It's a one-page, and this is the interactive part. We've had a chance to hear some of the data, some of the stories, and this is a project we're doing through the health department, and we have a CDC associate, and we are going to collect this information from you today. So you do have a pen in your bag there. If you don't have a pen, please fill it. It's just very simple. Please list the top 5 issues and potential solutions that you see as priorities in Madison County, and as a priority issues on one side, and on the other side, possible solutions. One of the things that I wanted to, I wanted to share was, this is a perfect example of one of the awesome things about Madison County. 2 years ago, we were designated by the World Health Organization as a safe community. And I get questions about that. I deal with injury and violence prevention, mostly injury prevention, with the Safety Coalition. But I've been through a number of different coalitions that, like the Faith Task Force and Safe Kids and a variety of things. But this designation was all about collaboration. And it's actually, one big part is it is data-driven, and we've heard a lot about that and how we can look for solutions. The other part is the collaboration, having different aspects of the community come together, work together, and try to find solutions. And I just have to share this one thing that has stuck with me from the early days, and this is actually out of a program that was developed through the Faith Task Force, working with teenagers, called Life Choices. And some of you participated in that and supported that program. But one of the things that we saw as a protective factor was loving, caring adults. And you can look at all of these different things, and the framework with and that's the only slide there is, I promise, so I'm not going to go through that's it. But we are in Madison County, that includes Berea and Richmond, an international safe community. As part of that, we are also part of Safe Communities America. And the reason I brought this up is that I got to go and speak at a national conference of Safe Communities America and brag about Madison County and tell some of the things that are going on. And it's very exciting. There is a program that is coming up that some of you may be involved with at some point. We were kind of a pilot, in a sense, for the state of Kentucky. We were the first community in the state of Kentucky to become an international safe community. And through the Injury Prevention Center and the National Safety Council, they are now trying to spread this across the state of Kentucky with a special specific program. And they are going to draw upon our expertise, our experiences, and much of that is what you're doing already. I just wanted to say, be encouraging. We hear some of the stories that are frustrating. We all experience them in our work, where we see young people that are struggling to get by. And this is one of the things that keeps me motivated and keep going, is keep fighting the good fight. We have to. We can't stop, because we lose ground if we stop. The mentoring programs that are out there, the programs in the schools that are trying to get these kids to do some things. We have parenting classes through Little Ones with Hands, and even some that we're doing here that we're involved with parenting. So it's just keep fighting fighting the good fight. Keep doing what you're doing. Don't get discouraged. Know that, you know, that's just part of the human experience, is that we do have to continue to try and keep doing well for our young people and our youth. Phyllis, did you have anything else? You can come up. I will turn it over. That was the shortest one. Please fill these papers out. Leave them in the, right on the center of the table. You don't have to carry them anywhere. Just put them in the center of the table, and we will collect them up afterwards. And thank you all so much for being here.
You are all special, that's why you're here. You're all children's champions, that's why you're here. And we can work together to do more for our kids, and that's what's going to make Madison County better. There are a number of grants that are available through different sources, which means that a lot of the data that you have received today, you can use that data. You can call folks that are involved in other grants to get help to work on grants together. This is what we need to do in Madison County, and we need to continue. We cannot be satisfied, as Lloyd said. We're a collaborating county. There's numbers to get in touch with. I always give out my number because if somebody needs somebody, I just try to get you to the right person. That's my role, and my number is 200-0258. So you call that number, and if you're trying to get in touch with somebody at the health, I got an email last night trying to get into this conference today because they couldn't find anybody. You know, it was after 5 o'clock, and so that's what we did. And that's what I do, and that's what all of you all do. And so go forth, spread the word with those that you work with the organizations that you are in. That's also important. Kiwanis, Rotary, all of those organizations, they have good people in them that are looking for ways that they can do better things in the community. So please call on each other, and also you will be able to get information from this conference because of what the health department is putting together. And we will be sending out an email so that you can also order the 2012 book. And we will also send out the list of those who registered today that's got their emails on there and their contact information, if that would be helpful for everyone as well, because you might want to get in touch with somebody and you do not know how to get in touch with them. But at any rate, call on your friends, call on those in conference in your organizations, and we certainly look forward to working with you in the future in any way that we can. And ask some of the folks that are here questions as you leave if you have time. And for those of you that have the homecoming parades tonight, have a good time with those. We had one last Thursday night, and we've got 2 tonight, so that's part of it, and that's what's part of making it a Madison County great for our kids, because it's got to be fun for them to be involved in a very, very good situation. Thank you all so much for coming. I appreciate it very much.